Hey everybody, Dr. Brian Jacob here, talking to you about causes of groin pain. And I am a hernia surgeon in New York City. If you're watching this, you probably have been on a path trying to figure out what's causing your groin pain. And so, this concept of having groin pain, there's a lot of different causes. And inguinal hernias are hernias that are in that crease between the leg and the abdomen. Can either be obvious, meaning we feel them, or less obvious, meaning they're hidden. We sometimes use the word occult or hidden hernias for that. And these are tiny little defects with little pieces of fat in them that do cause pain, but oftentimes are missed on exam or on imaging. You may also have a femoral hernia, which is a hernia through a tiny little canal next to the femoral vein in the leg. Or you may have had a hernia repair in the past, and this is just a way it's presenting as it's coming back. And yes, hernias can come back. And these are in a long list of other causes, including but not limited to surgical tacks or sutures from previous repairs, old pieces of mesh, which we call meshomas. These are old mesh from prior implants, prior hernia repairs that ball up and can cause pain. And I'll show you one of those on a CT scan in a second. You may have a trapped nerve from a suture or even just from playing sport or honestly from waking up. Sometimes you can get a pinched nerve in your back. You can actually get a pinched nerve in your groin where it gets squeezed by a tear in the fascia and it can cause pain. In addition, you can have a little fatty deposit, very benign fatty deposit that runs along the spermatic cord in men or in the round ligament in women. And this can actually cause pain as it starts to get squeezed. These can usually be removed during a hernia repair. Sometimes they're missed, or sometimes they grow after a hernia repair and cause pain, and they often get misdiagnosed as a recurrent hernia repair, but really they're their own entity as these fatty deposits develop around the round ligament. Sometimes you have endometriosis. You can get a little piece of endometriosis on the round ligament or in that inguinal canal, and that can cause pain. That pain can be constant or it can actually be cyclic, occurring with the menstrual cycle. And then finally, a whole world of injuries from working out, injuries from trauma, injuries from sport. And those can involve the pubic bone causing osteitis. You can have a tear of the rectus sheath or the ab muscles as they insert on the pubic bone. You can have a tear of the adductor longus or the leg tendon as it inserts on the pubic bone. The actual plate that those two tendons implant on can avulse, and that can cause pain. And of course, you may also have some back or even hip causes, specifically labral tears that can cause groin pain. So the list honestly goes on, and this is not even complete as I've left out some of the intra-abdominal causes. But as we focus this short video on hidden hernias or femoral hernias, what you'll see in my office first is we'll do something called pain mapping. We'll figure out exactly where that pain is. What we do with that pain mapping is we actually correlate it to imaging. And all the imaging I get, we always include a marker, a little white marker at the site of the groin pain. And what this does when we get the imaging, here you see a CT scan, is it allows us to focus on what's directly underneath that marker. So here's the white marker, here's what's underneath the marker, and you can see there's something there. And this is actually a meshoma or a mesh plug. Uh, one of the most common surgeries out there is an open incision inguinal hernia repair where they take a ball of mesh and put it in, and that's called a mesh plug. And most of the time it works, and sometimes it causes chronic pain. In the situation where you've had a mesh plug and that's where your pain is, the treatment is to have that plug removed. We can figure that out with pain mapping and a CT scan. We may also get an MRI with a marker, and this helps us look for more of the injuries. And here you can see a fascial tear with the white fluid. And so there's the marker, and it tells us to look right underneath there. And while the patient may come in, you may come in saying, I may have a hernia. In reality, you actually just have a fascial tear from an injury, and the hernia repair itself won't treat the cause of pain. So very important to do these workups before you go down the path of getting a hernia repair, just in case. MRIs are great, and so are CT scans, and so are sonograms for picking up hernias. Here you see a right direct inguinal hernia as some of the fat is actually bulging out during a tense maneuver to try to push that tissue out. So you can see it does actually pick up on those. It also picks up on fatty deposits, like I mentioned before, that lipoma in the spermatic cord. You can see those on MRIs too. And if your surgeon and radiologist work together closely, they can oftentimes figure out what the cause of your pain is. One of those causes may be a femoral hernia, and this is an example of a femoral hernia. You can see the little fatty deposit coming out through the femoral canal, and this is a lump that's felt in the groin. It's usually a little bit lower than inguinal hernias and very easily treated with either an open femoral hernia repair or a minimally invasive, a robotic or a laparoscopic femoral hernia repair. All are great techniques with very rapid recovery. Last example of a hidden hernia. This is a patient with pain. We mapped the CT and the MRI were normal, meaning they showed nothing. And so what we'll do there is a diagnostic laparoscopy. We bring you in, we put general anesthesia, and then we take a peek with a camera and we look down at the exact site of that pain. And as you can see here, when we lift up some of the tissue, there's a hole there. And that hole is exactly what an occult or an inguinal hernia would look like. So no, there's nothing in it, but it's there and it can cause pain from time to time. So that gets fixed with mesh and the patients get better. And yes, mesh is controversial, but it is actually a very safe implant as long as it's implanted correctly for the right reasons. And you can consult your doctor on that specific debate if the time comes for a mesh implant for you. So in summary, femoral hernias and hidden inguinal hernias are rare causes of groin pain. Definitely consult your surgeon if you think that you may be experiencing pain from one of those types of hernias, and they can do the workup and then, of course, discuss with you the treatment options that they feel are best for you. If you want to reach me specifically, you can shoot me an email. The address is down there, nychernia@gmail.com. Thanks.